Thank you. Hello, my name is Cynthia Demise, and I am the project manager for the new Pride Agenda. We thank you all for joining us. This is our first virtual town hall. We anticipate having many more. Just to give you a little bit of an understanding of the new Pride Agenda, we have organized to particularly focus on LGBTQ community, focused particularly on the most underserved. Some of you may have heard of a previous organization called Empire State Pride Agenda, ESPA. Some of us were involved in consulting and helping with them, and others in our leadership and our grassroots movement were not. But all of us were very saddened by the close of ESPA, the dissolution, and feel very strongly there's a great deal of additional work that needs to be done. And it's not about the LGBTQ community just being at the table for healthcare matters. It should be at every table in New York State and beyond, whether it's fiscal equity, housing, education, every single table we should have representation, and that is our goal. Our mission was essentially to do two things. One is to begin an advocacy focus in New York State. We have begun that this fall in Albany. We have focused on a variety of issues, including full implementation of the Gender Non-Discrimination Act, calling attention to the lack and very poor implementation of Dignity for All Students, which was passed years ago and poorly implemented. It deals with anti-violence in schools, affecting our community and many others, and our efforts in support of helping increase the money for the Health and Human Service LGBT network. We are very pleased that we made meetings with the governor's office and the governor and the staff, and we're very pleased that in regard to gender, he made a decision to put in mandated training for all state employees, 340,000. It's our first little victory, which we did with others, of course. But there's much more work to be done. Our second goal is essentially to get us all a bit more involved in civic engagement. Some of us are older and we vote, we may write a check or something, but we may not do grassroots organizing anymore. Younger people, we need their energy, their ideas, but their involvement as citizens in New York to hold electeds accountable. So we are called the new Pride Agenda, because it's a mix of many races, many different focuses. We're just beginning in New York. We're going to go into Westchester, Long Island, upstate Western New York, Syracuse, Buffalo, Albany, etc. Our civic engagement project we're doing in collaboration with Columbia University. It's going to be research-based, focused on different communities in New York City and upstate. We're going to look at who has been engaged and how we could increase engagement in a way that's acceptable, engaging, exciting, fun. But it is all about taking more power and power that we deserve as citizens. So while we had hoped to do some direct program engagement beginning in April, actually in 20 targeted communities in New York City, some of you may have heard about it. Obviously, with the onslaught of COVID-19, that's was totally unacceptable. We made a decision the last 2 weeks to pivot to virtual town halls, which we are doing for all invitees. Anyone that would like to join is more than happy to join. Simply go to our website, newprideagenda.org, and there's links to join. I would like to begin by acknowledging our New Pride Agenda team that has helped put this together very rapidly, as well as our guests. And I want to give it first to our logistics man for this exercise, who has been invaluable to me from the beginning. Ahmed Mohammed. Ahmed, please take it away.
Thank you so much, Cynthia. And again, thank you guys for joining us. We're hoping everyone is staying healthy, safe, and in good spirits in these uncertain times. I know it can get scary and just anxiety-inducing being cooped up, and so hope everyone's staying healthy. I'm, like Cynthia said, Ahmed Mohammed, community organizer for the New Pride Agenda. I moved to New York I think it's like 7 months now after graduating undergrad this past May. Been working to engage the community and build this program out ever since. And I'm excited that you all are joining us. Hopefully in the near future, we'll be meeting in person and not virtually. But in the meantime, virtually we'll have to do. I do want to let you guys know that we have a series of these town hall events planned and scheduled for the near future. The next one is this Thursday, the 16th, and it's focused on youth and isolation and what it means to not be with your friends at school, particularly those who are LGBTQ, and working with getting to know their identity in these uncertain times. And the following one is going to be the next Thursday after that, the 23rd of April. That one's going to be focused on fun topic, sex, but also serious topic that a lot of people engage with in our community, and that is sex workers and what it means for them in this precarious time. And so I'm going to hand it off to Jason, who will do a bit of work explaining the programming tonight. But again, thank you guys for all joining us, and hope to see more of you guys soon.
Great, thanks, Ahmed and Cynthia. Again, my name is Jason, use they, them pronouns. Also want to just express and share like greetings and welcome and thanks and appreciation for everyone who is participating with this conversation today. This is a very like serious time for all of us, for people of color, for queer folks, for trans folks, for our community. So we really want to do our best in making sure we are providing space and access for our community to talk about key issues that impact us as LGBTQ New Yorkers, and really figure out ways that we can show up more for community and show up for each other during this time. So we have a really, I like to think this is a very star-studded panel of kind of like experts, geniuses, and brilliance in their own right, who are actually doing like leading work and have been doing the work for some time now. And as we enter a challenge in our work, right, of how we show up for community because of social distancing and because of virtuality, we really thought it was important to kind of like start this this series by talking about some of the most vulnerable folks in our community, people living with HIV, drug users, and our elders and seniors in our community. So we really want to provide space for those communities and for folks who love and care and have friends and family and loved ones that are part of this community, so we can figure out the best ways that we can show up for each other and for ourselves. For our program, we're going to pass it over to Doug Wirth, who is an amazing leader. Doug, I see you as an activist too, you know, very like a leader, trailblazer, and doing some amazing work. Who's going to, I'm now going to just shift over to Doug to introduce himself and introduce our panel, and we could really get started into this very important conversation. Thank you all.
Thanks, Jason, Ahmed, and Cynthia. It's exciting to be with everyone. I can see some of the chats, the comments starting on the side of the board. So thank you for being there, everyone, and being with us. And thanks so much to Jason, Ahmed, and Cynthia for pulling this together. I'm Doug Wirth, President and CEO of Amida Care. I also have the pleasure to serve on the board of directors of the New Pride Agenda. And so I want to bring you greetings from the New Pride Agenda board. Cecilia Gentili, the board co-chair, and I thank you for being with us here tonight. So let's get to it. Let's hear from our esteemed panelists. Our first member of our panel, Dr. Oni Blackstock, is the Assistant Commissioner for the Bureau of HIV/AIDS Prevention and Control at the New York City Department of Health and Mental Hygiene. Nathalia Gibbs, the LGBT and Harm Reduction Coordinator at the Harm Reduction Coalition, and Steve Wilkinson, who is the Senior Director of Programs and Services at SAGE. So Dr. Oni, Nathalia, Steve, thank you for being with us. So let's begin, Dr. Oni, you know, your important work at the health department, and just curious, how does COVID-19, both the nature of the virus, as well as the shift in sort of daily living. How is that impacting people living with HIV and the work that you do through the city?
To be here on this panel. And I also just want to hold space because I know that folks are being personally impacted by COVID, having loved ones who are either sick or who have passed away. And so just want to recognize sort of the trauma that people are experiencing in this time, but very happy to be part of this community with you all this evening. So, as the Bureau of HIV, we lead the city's response to the HIV epidemic. And, through a lot of the community partnerships we have, both with people living with HIV as well as with providers, we kind of hear firsthand what are people's questions. And so a number of questions, started coming to us very early on, maybe about a month ago. So, people living with HIV were asking us, are we at increased risk for acquiring COVID or for having, worse outcomes? And then we were hearing from providers, what should we be telling our patients about, their risk, what should we be doing? So, as a health department, our role is also to provide guidance to providers and to the public. And I should first say our health department right now obviously is in the midst of this overall agency response to the pandemic, which is really about bolstering the healthcare system and supporting it. In terms of the Bureau of HIV, so what we did is we developed guidance for HIV providers as well as people living with HIV. And really the question again that people had was, are we at greater risk? And the reality is that we don't have that data yet, right? Because this is like a very new evolving situation. But we do suspect that people living with HIV, because the cohort of folks living with HIV are aging, and I'm sure Stephen will talk to this, are aging and have a number of chronic comorbid medical conditions, that just having those, just age and having those chronic medical conditions would put many people living with HIV at increased risk. And then presumably if one had a low T cell count or CD4 count, they would be immunocompromised and potentially at greater risk. But the reality is we're just now collecting this data, and at the health department, we hope to at least have some smaller studies to be able to elucidate this more. We also put out guidance, sort of more fun guidance around sex and COVID. We know that people still want to engage in pleasurable sexual activities. So my team developed guidance for how to have pleasurable sexual activity whilst reducing the spread of COVID. So we put that out, and that was kind of some levity in this otherwise very sad situation. And then also we're holding also a series of town hall meetings, sort of similar to this with our community advisory board. So we have the Planning Council, which is federally funded, sort of a community advisory board for our Ryan White Part A programs. And we're gonna be able to answer questions for consumers and people living with HIV on that. And then also similarly with our HIV prevention group, we'll be holding something similar. So we've also, just one last thing, is supported a number of our funded agencies in pivoting to telehealth. So I think we all, telehealth, I think, one positive aspect of what's going on is that it's really accelerated adoption of telehealth, and it probably has lowered barriers for engaging in care. I think we make patients jump through a lot of hoops to be in care. And so with what's going on now, we're able to be like, what is reasonable? And so we're putting out guidance to HIV as well as STI providers about how to pivot their services, and sort of just guidance about sort of transitions that be made given what we are experiencing, and how we balance, engaging in care with also reducing the risk of being exposed to COVID. So that's a little snapshot of what we're doing.
Dr. Oni, as you think about, people who may be participating, listening tonight, they may be living with HIV, they know people in their social networks, right? So what are some things that that you really would want people to know about in terms of things that they could do to reduce their risk of becoming COVID positive? How do they take care of themselves? What do we need to pay attention to now?
Right, so there are a few things. So, ensuring that one has an ample medication supply. So if possible, getting a 60 to 90 day supply so that you're not having to go back to the pharmacy all the time. We're not experiencing any shortages with regards to HIV medications, but we don't know what the future holds. So we want to make sure that people have the medication that they need. Social distancing, again, I mean, people should, if someone has a home and in a place to stay, that's safe, to stay inside unless they need to go out for emergent care or for food. And again, really weighing those risks and benefits of like going to the clinic versus, whether things can be taken care of at home. We've also given the guidance that was released, I believe, earlier this week or last week around face coverings. The face coverings, I just want to make sure people understand that those are, apologies, that those are for actually the protection of everyone else. So face covering, right? So there's this concern about spread from people who don't have symptoms or people who may be very early on. And so it's important for all of us to cover our faces. There's much less data about whether this approach is protective to other people, but we all should play a role in terms of like collective responsibility. And then, obviously taking advantage of telemedicine, telehealth, if that's an option available for people's providers. And if folks are going to be at the clinic, making sure they're getting vaccinated, they're up to date on their other vaccinations for flu and pneumovax. So those are some recommendations.
Great. Thanks, Dr. Oni. So Nathalia, let's come to you as we think about drug use or health and some of the challenges that emerge from COVID-19 and people having to social distance and so what's happening? What are you seeing happening in terms of drug use or health with COVID-19?
Yeah, so I think that what we're seeing in HRC, a big part is a lot of fear and a lot of confusion about what approaches to take, and also kind of getting all of this information that's incoming about protective gear, about stocking up on medication, about social distancing, and really trying to make that pragmatic for people who use drugs, especially people in the queer and trans community who are marginalized in these ways and already experiencing poverty at increased rates, and kind of taking some of this information and making it practical. I think there's a lot of, this idea of things are shutting down, there's less, we're making ways for people to do things inside their homes. But a lot of people who use drugs, and a lot of people in general, don't have homes, can't do some of these things, can't afford to stock up on medication or on drugs if they're using, can't afford to stock up on supplies. So it's really been taking the framing of kind of the shutting down and shifting it to how do we make this work in this situation, which I feel like is a really kind of big harm reduction principle of just making this pragmatic, making this realistic, of like, syringe exchange service programs can't shut down because that puts all of these people at risk for death, honestly, for overdose, because they're isolated. They're having kind of this compounded level of stigma. We're hearing things about people not wanting to do rescue breathing because of the very real fear of COVID transmission in that situation. People who are being advised not to use Narcan to reverse an overdose, people not having access to the supplies that they need to use safely, putting them at increased risk for things like HIV, for hepatitis C, for anything that might come from shared needles or something like that. And so finding spaces to take the information that we're getting and shifting it. So it's been like, how do we advise service programs to shift? So it's been like, maybe we're doing things where we're not having drop-ins, but we're doing like taco truck style is what we've been calling, having drop-offs for people to get supplies and giving them in as large quantities as we can, not just for people, but for the people who we know can't isolate, to distribute among their communities. I feel like we've been seeing this huge resurgence of like mutual aid in its really true form, and that's a huge harm reduction principle of like, how do we kind of shift? So taking information that we've known about cleaning needles with bleach, if you have to reuse them, and having all of that information at the ready because it might be necessary. So what we've been doing at HRC is trying to kind of create spaces to facilitate the exchange of information. We're acknowledging that, as Dr. Oni mentioned, that we don't have this kind of like huge evidence-based push of information to supply. We're learning about symptoms emergently, we're learning about issues emergently. So we've been facilitating spaces for people who are in the field and still doing the work, and also for people who are experiencing this to talk about what's been working for them, since they are kind of the ones who will have the best knowledge about that. So it's part of the approach that we've been taking.
It's great. What is one thing that you would want people who are listening tonight to really be zeroing in and thinking about? One thing that we can do to take care of ourselves and others in terms of, remaining healthy and not acquiring COVID-19?
Yeah, I think that's really tricky. I've been thinking about that myself a lot. One thing that I really would want people to kind of take away is really finding healthy ways that feel good to balance risk, but also to balance fear. And that in this time, especially, what we're seeing is that community care is the most important thing. It is the thing that is saving people. It is, people are bringing each other food. People are providing practical, like, financial support. And so that is what is keeping us together, and that is what is keeping us alive. And that's, so when we're doing these things, that we have to remember to kind of not let fear and stigma push us away from that community care, not push us away from saving a life by doing rescue breathing, from not pushing us away to acknowledge the increased stigma that if someone is using drugs and feeling symptoms of COVID-19, they're having this huge level of fear that is going to give them an additional barrier to care if they're trying to engage or get a test or find someone who's going to believe their symptoms.
Yeah, as I'm listening to, part of what I'm thinking is, you're in a way, you're really saying there's a big difference between social distancing and being isolated or in isolation. And I think that's something that's really important to all communities, to all groups of LGBT people.
Yeah, 100%.
Yeah. So Steve, let's come over to you as I think about our elders and all of the news that's been on the TV and the radio and on my phone. Certainly the risk has been documented in terms of elevated for elders and people as we age and develop other comorbid conditions. So what's happening at SAGE and in your world as you try to support LGBTQ seniors around this COVID-19 crisis?
Thank you, Doug. I'm Steve, and I use he, him. So yeah, thanks for asking that question. We know that older adults are accounting for about 75% of the cases of COVID, right? We also know that the almost 65% of folks who are living with HIV are older adults. So both worlds are highly affected by, COVID and what's going on. What we know from our participants and our community is that they've lived a life, as so many of the folks that we work with have, of being marginalized and not trusting institutions, not trusting information, and not being out, not being able to be out. We know that our elders are twice as likely to be single or uncoupled. We also know that they're 4 times more likely to not have children in their life. So when you look at a model of who's caring for folks who become ill, and we know this from the HIV epidemic, it has to be a horizontal model and not a vertical model. And so peers are there for them, and SAGE is there for them to help provide those supports. Ahmed had mentioned having a discussion about youth in isolation. Isolation is a tremendous issue for LGBT elders. LGBT elders Like I said, they're not known in their community as, being out. They can live very private lives. It's not like people would think, oh, everybody's just hanging out on the streets in Chelsea. That's not what's going on. Their neighbors don't know, so they will come to a SAGE center, or prior to that, when they were younger, maybe to the LGBT center to participate in events and to be with a community. And so the loss of that right now is really impacting them. And from a couple angles, one is the isolation, and the other is the nutrition and their risk for nutrition insecurity, because senior centers provide meals. A senior center will provide a lunch, or a senior center might provide a dinner. Many of our folks will go to our Harlem center for lunch and come to the Edie Windsor Center in Midtown for dinner. So that's been a huge lift to work with the Department for the Aging to try and ensure that they're all getting meals delivered, and to continually trying to help where it's not been a perfect system because it was just rolled out 2 weeks ago. They're doing their best, and a lot of people are getting their meals, but you can imagine being frightened to leave your home because you're in that high-risk category, and yet your refrigerator's empty. And who could, there's nobody that's really, they might have called SAGE in the past to have some volunteer run over and help with an errand, but that's not really happening. There's not those folks who can really help people to go and do their shopping. So it's been a really frightening time. We have a little over 3,100 participants that our staff are connecting with on a weekly basis to try and create that some semblance of them having a connection to the world. Our logo, our motto is, we refuse to be invisible. And we've actually heard from some people say, oh, thank God you called me because, I'm not invisible. I think it's really easy to, when you're in an apartment, you're living alone, to start to feel like I'm invisible behind this door. I'm the older population. Nobody's really going to care about me. So it's been a difficult 3 weeks now since I think it was the 15th that the announcement was made. So, but things are slowly getting back on track. Now it's the isolation, and folks really kind of going stir crazy. And the calls that might have been 5 minutes the first week, oh, this will be okay, I'm going to do fine, don't worry, are now 30 minutes, 45-minute calls. So we're working at trying to connect them with more resources so that they can have other outlets of folks to talk to. And I can tell you more about other stuff we're doing, but I think that answers your question.
Yeah. So I think all of you talked about stress, right? The increase in stress on people living with HIV, on folks who use drugs, on our elders in our community. Does trauma get triggered by this additional heightened level of stress? And what does that mean for the services that you're providing in the community?
Can I answer?
Sure.
I hadn't really been connecting it or thinking about it, but the Washington Post did an article on our residents in Fort Greene that we just opened a few months ago, and we have 90 residents now who have moved in there. LGBT, it's the first in New York State residents for folks 62 and over, and affordable low-income apartments. So they had gone in there and they had interviewed some of the residents who are LGBT, and they were like, oh my God, to us, it just reminds us of the AIDS crisis. And until I read that article, I hadn't really kind of connected that for me, who back then I worked at the People with AIDS Health Group, the New York Buyers Club, importing drugs for people with HIV. And I realized that there is this triggering of previous trauma, like who's going to be next? Who are we going to hear about? Having staff who are ill, and you're wondering about them on top of what you're doing to provide services. So yeah, it's and it was so interesting that the participant connected that. So yeah, and so we're trying to help them with that in the sense of being there for them to talk about it and to not ignore it.
Thanks.
I want to add something a little bit too, is that I've been thinking about that and hearing that from different folks, but I also want to kind of bring into play the idea that this ongoing pandemic is also trauma, so that there is kind of this like barrage from all different levels, is that it is triggering for old trauma in terms of the kind of HIV crisis, but also in terms of anybody engaging with healthcare or thinking about death even remotely. There's this new trauma for people who maybe haven't had that experience or have feared that experience. There's vicarious trauma from people who are on the front lines working with people. There's kind of this trauma that comes from the general like air of helplessness that people are feeling, being isolated in their homes, being unable to use a lot of the tools that we've spent time cultivating to get through stress and trauma, and not having access to them at all. There is this trauma that comes with the secondary fear of kind of economic and financial stress, with people losing their jobs, being unable to work, trying to, be at home with children if that is something that, is part of their life experience. And also this fear that comes and this trauma that comes from the way people are talking about COVID and the way people are talking about care. I think I've been thinking a lot about like different harm reduction principles and this idea of health and dignity, that we are turning people away from care, that there's this fear of there are certain people who will get ventilators and certain people who will not. Kind of this fear that comes across from like, who is the deserving person and who is the non-deserving person, and when am I going to be if I'm in that place? And I feel like it's important to both acknowledge that it's a triggering moment, but also a moment of new trauma kind of all at the same time.
Thanks. And I think part of what, as I'm thinking what you're touching about, all the headlines about health disparities and the ways in which people of color are disproportionately impacted by this, which is on top of, years and years and years of not paying attention, not investing. And so I'm thinking, Dr. Oni, what is that? What are the challenges that are really being uncovered or spotlighted around health disparities and health justice and health injustice that we should be paying attention to here? I think you're on mute, Dr. Oni.
Sorry about that. Okay. Can you hear me? Can you hear me now?
Yes.
Sorry.
Great.
Yes. Yeah. Our former health commissioner, Dr. Mary Bassett, she would say that epidemics track along the fissures of society. And so, folks who are marginalized and who have marginalized identities, and particularly intersecting marginalized identities, are obviously most vulnerable. And, at our agency released yesterday some race ethnicity data that showed that Latino and Black folk were about 2 times more likely than white folk in New York City to die from COVID. So for us, this has been, very challenging, because as we think about, 90% of people newly diagnosed with HIV last year were Black or Latino. So we're looking at, we look at Queens and the Bronx and these epicenters of COVID, the COVID pandemic in New York City. We're just seeing the same communities impacted, and we at the health department, we have lots of maps that maps for poverty, maps for for diabetes, asthma, and they all look the same. and the COVID map looks exactly the same. And so, we have an equity task force at the health department that is really interested in how we can really address this. Obviously, this is from, as you said, years and centuries of inequities and disinvestment and plunder. But I think we're trying to do as much as we can in terms of outreach to the communities that are impacted. Getting folks access to testing. Supporting the hospitals that are located in those impacted communities. But there's some things that are really hard. Like, for instance, Queens is being most impacted, but we have, most overcrowding in Queens. We have multi-generational families. How do you socially distance? So the health department is providing alternative housing and looking at alternative care sites. So other ways that we can help folks do this who don't have the luxury of being able to socially distance. But it's an ongoing issue that we are really grappling with.
So you really bring up, the local response, right? And so I'm just wondering from everyone's perspective, I think the local response is really contrasted with the disorganized response at the federal level. I think we're fortunate to both live in New York City and New York State, and to have our leaders supporting us at this time. But how do you assess sort of the governmental and the community response from the beginning and where we are now? What are your thoughts?
I can start. I think that when it first started, or kind of any time there's talk of a pandemic or epidemic, I have a coworker who always says that there is no such thing as an epidemic, that there are only predictable consequences of deliberate choices. And I feel like that's something that, again, rings true for me here, is that there was kind of this very slow response. There was this really, big denial and kind of, desire to fight preparedness, and desire to kind of like quell anxiety and fear by not acting and denying kind of what people's experiences were. And I think that is hugely problematic. It feels like kind of like a massive gaslight of what people are experiencing in their everyday lives and the very valid fears that they're having. Counter to this reaction. So talk of like, there are plenty of ventilators and then there aren't enough, especially thinking about New York being this epicenter at the moment, and me communicating with people who are in other states who are kind of seeing this reaction, seeing the gaps and the missteps that have been in the reaction, and then also seeing their own states kind of still not responding in a way that would feel appropriate, which is super contrasted to the community care, which is kind of, as traditionally been this huge, emergence of mutual aid and all of these resources and people coming together on a smaller scale to put out guidance, to put out things about, safe sex during COVID, to, have calls for 45 minutes with people who are isolated. And I feel like that is kind of like the traditional sense of like, it's usually grassroots comes first and smaller actions come first. And that kind of, there's always this grappling of institutions of like, oh, this is working, we're going to find a way to kind of jump onto that or pour funds into that. And so it's kind of like, when is that going to happen? When are they going to see that these are the kind of interventions that are working in this moment and support them fully?
I would echo what Nathalia said, but I would also, it felt like for us at the time as an agency, I think we were more concerned for a number of weeks, for a few weeks, and we're trying to figure out how are we going to protect our seniors. They're coming into a congregate setting. These are congregate meals. This is a congregate place. You're in a movie. You're watching a Broadway singer. You're whatever it is. It's congregate, and we knew that wasn't where we should be. Where that wasn't going to be great. So I think we got a little frustrated in that we just wanted more. We wanted something more definitive. It finally came Prior to that, we really worked to try and make sure that people understood how to take care of themselves. Hand washing, all of the directives, and really trying to work with our folks. Of course, depending on what news channel they're listening to, wouldn't necessarily believe that, wouldn't necessarily heed that advice. We were doing the best that we can, but sometimes there's that, between the agencies who can make certain, who are doing the work, and the funders and what they're expecting, where we got to kind of figure that out. But at the time, it was a little frustrating. I think since then, with the governor's directive, the mayor's directive, certainly the Department for Aging has gotten on board. I think, what they're doing with this delivered meals for seniors is a massive undertaking, because it's like 30 or 40,000 meals that are being delivered to folks. Or 30 to 40,000 people getting meals, which is tremendous. It's not been without its hiccups, but things have been getting better. And what more could we expect from that? So my lens has been really kind of focused on, that, and that dynamic. I think for our participants, and going back to the sense of trauma and everything, I think they've been feeling really traumatized for the last couple of years. I think they felt really happy and excited, and then things changed in the world. And I think they started to feel really unsafe. And people who might have put their name down on a petition or signed something wouldn't do that anymore. It was returning to a previous time in their life, again, another years of trauma, right? Of where they didn't trust it anymore. And so this is like just the final thing, or not even the final thing. I think for some of them, they were able to kind of roll into this more, or at least handle it a little bit, because they've been feeling so bad over the last few years. But on the other hand, I just want to make sure that we talk about the resilience of our community and how they pull together. And they have been through hell, and they figure they have within them often the tools and the ability to make it through, which has been amazing. And the calls I get from people who want to help out other people, it's just, it's amazing. So I want to make sure we also highlight that.
Thank you, Steve. One of the questions that came up from our participants, Dr. Oni, I think should come to you. The question is really around surveillance and monitoring. Is that occurring around COVID and HIV? And maybe to talk a little bit about the purposes and why that's important.
Right. So as part of our agency response to the COVID pandemic, we are collecting lots of information from all the various hospitalizations, lab tests that are done, unfortunately deaths as well, collecting all of that in a centralized registry. And then we also have our HIV registry, which we have all the time, and that's where we get information, people who are newly diagnosed, people are out of care, and that's how we know to go find folks who have been newly diagnosed and to find out more about them and what their risk factors may have been, and to notify their partners. So in terms of that work, the partner notification and going out to talk with people who are newly diagnosed, we had to pivot more to telephone and video conferencing with people. And actually, even before all this happened, like 60% of our outreach to partners and persons who are newly diagnosed was virtual. So we were just sort of increasing on that. And we are undertaking a match to look at folks who are in our HIV registry who may have been hospitalized or died from COVID. And so we're hoping to have some of that information soon to get a sense of whether people with HIV are being disproportionately impacted. So some of our surveillance activities in HIV are being limited. Like, we can't get in touch with someone by phone. Often we have to go out and find folks. So that's not happening because for obvious reasons. But we're doing the best that we can with the data that we have.
Thanks. And another question came up, and I think maybe, Nathalia, I'll ask you to maybe, if you would, lean into this one. One of community members interested in really about interactions with law enforcement and have they changed because of COVID, and specifically thinking about drug use or user health. What can you share?
Yeah, I can't share anything definitive about how things have changed. I know that it is really complicated. We have all of these kind of orders. I guess it's pause here, but essentially shelter in place, and we don't quite understand how that might be enforced. And if it is being enforced, now we have the new kind of wear masks when you're outside, and there isn't really a clear guideline on how things are being enforced. And I think that's where kind of it's hard to make any kind of statement about what's going on. We don't know what the priority is. There's kind of mixed messaging and mixed signaling about what the priority is, especially as the infection rate in kind of our incarcerated populations is rapidly increasing. And there is kind of this push to, not really release people, especially people who are older, who are really at risk. And everybody who's in there is at risk, but also kind of an increase in policing. We just saw bail reform rolled back. And so one could guess that might mean that there is some intention to continue enforcing, parole violations or other administrative charges or policing in any sense that is, legitimate, that could happen. There isn't really much talk about what that's going to look like. So it's a little bit hard to say. I feel like, there are, it's really important for people to gauge risk kind of for themselves, and in thinking about, if you have protections, if you have a certain service program card and you are affiliated with an organization and that's where you're picking up materials and supplies, it's hard to say what we're doing with people who are living on the street, who are sleeping on the subway, what's happening there, what kind of enforcement, what is that looking like, where are they directing people to go now that we have less outreach. It's really kind of this tense situation of kind of waiting to see who's going to move first and what's going to happen. Clearly, we're not slowing down incarceration. So, we are recommending that people be as safe as they possibly can, and kind of navigating the risks of whatever they're doing in a way that feels safe and best for them.
Thanks. The other part of this exploration around the local government response is also thinking about the local community response. And Stephen, one of the participants wanted to ask a question of you about how can people in the community support LGBTQ leaders during this COVID-19 pandemic?
Something I wanted to reference, which is supporting LGBT elders, certainly, is a program that we started last week called Sage Connect, where anybody who wants to connect with an elder and be somebody who they would talk to during the week can go on to sageusa.org and sign up as a volunteer. And then we'll be matching them with elders. So it's another connection. So that's really something that could be helpful to us. We're getting a lot of folks who want to help in so many ways, but as you know, there's a limit right now to what we can do. And we stopped doing grab and go meals at the senior centers because we don't want seniors to leave their homes. It's much better if they stay there. So we agree with that, and certainly DFTA wanted us, all the senior centers in the city, to stop doing that, because the more they're coming out and could be potentially exposed. We are doing certain amounts of staff work in controlled ways at certain sites, but you also have to be careful of your staff and making sure that they're protected. For a while there, we had problems with PPE, as everybody's had, but finally we got the back order in. So, I mean, that's one concrete way that people can help, is to volunteer. Be an ear for somebody. Connect with somebody. We're asking people to do that for 6 weeks. That's all. That's the commitment. And then we will, if we need to extend it, we'll extend it and, see where it goes. But it's so valuable to our participants. And we know that from our Friendly Visitor program, from the volunteers who come and serve dinner at the centers or lunch. They're the ones, they're great. And making that commitment is really a nice thing for the LGBT elders.
Stephen, can you give that website information one more time, just so that people can...
It's sageusa.org. And the nice thing about Sage Connect is it is connecting people across the country too, because we have affiliates across the country. So, we're kind of fortunate in New York City because we have the Department for the Aging and the New York State Office for the Aging, and the funding that we get is great. We're able to offer meals every day and have programming every day. There are senior programs out in the world or counties that don't have anything, or they may only meet once a month. And we have LGBT elders who live in those areas. So our affiliates do certain levels of work with them, but they're not funded the way that New York City is. So we're opening this so that it's nationwide, so anybody could really participate and call an elder no matter where they are, which is great.
Thanks. So Nathalia, how does the community get behind and support drug use or health around COVID-19, always, but especially during this time? How can we support the work that you're doing?
So in terms of Harm Reduction Coalition, since we're not a direct service organization and we do a lot of kind of capacity building and technical assistance for some of the organizations across the city and across the country, I think some of the big ways are reaching out to some of these organizations and figuring out what they need. There's a big need for PPE. There's a big need for kind of, if people are willing to do things like drop-off services and delivery. We have a lot of places that are kind of doing things where they're like rotating their staff or keeping their staff in small groups so that if somebody does become infected with COVID-19, that it doesn't expose their entire staff to that. So plugging in with groups, seeing what organizations need help and support and what that help and support looks like, whether it's financial support for some of the organizations that do meals, whether it's support of kind of hygiene items that they may give out to their communities, if that's something that, that they would like support on. And I think also just acknowledging the reality and checking in on community. I feel like a lot of times we think of the, community of people who use drugs as this community, but a lot of people use drugs, whether they are telling you about it or not. So I think that a lot of times unpacking that stigma when you're thinking about helping your community around you and acknowledging that there are people around you who use drugs. And so maybe if you are in contact with them and you have naloxone and you find out that somebody might need it more than you, if you're not a person who's using, passing that off to them, or checking in on people, offering to check in on community who's using. If you're isolated and using, you're at high risk for overdose. And so having somebody to call or check in on you and make sure that you're okay is really important. So I think just acknowledging that people use drugs and feeling prepared and equipped to talk about it and to support people is really important.
And you mentioned bail reform earlier, right? So, sometimes crises like these can be used by electeds to take no action. And I'm really wondering what your thoughts are around bail reform, criminal justice reform, the Walking While Trans bill, marijuana legalization. this is not a time, we may need to push pause, but this is not a time to walk away from those important initiatives, would you say?
Yeah, I think that's a huge thing. I mean, I personally also with HRC do a lot of work on the walking while trans ban, and we've had calls about like, it seems like they're not going to meet again. What does this mean? Can we get this in the budget? This is like one of those things that is, if we're rolling back bail reform and if kind of we're not doing anything to slow the rate of incarceration, people are going to be targeted, and disproportionately we're seeing, especially for the walking while trans bill, if this is something where there's a lot of fear and stigma walking around about who's walking around in general, whether or not they have a mask, that's a huge risk for targeting, specifically in reference to that bill, trans women. If people are, there, I forget which state, but there was a report of officers being told not to reverse overdoses with Narcan or not to carry Narcan. And so if that's something that is being thought about, that, I'm afraid to touch this person, to help this person, people not arriving on the scene, like that is a huge risk of people being increased stigmatization. And in terms of the rest, I mean, I think that in terms of thinking of New York as a whole, if we are going to get a better grasp on the pandemic, that we really do have to think about our incarcerated population, because in the city and across the state, there are entire communities whose entire economies are dependent on the prisons that are there. And so if we have officers who are going in and out, who are transferring between different floors and different prisons and different jails, they're going to be putting people at risk inside. They're going to be putting their families and people outside at risk. So, it's kind of this thing that feels very backwards, because we're not really doing enough to care for the people who are incarcerated. They're, and thinking specifically about, our queer and trans people who are incarcerated and the increased violence that they're exposed to, the increased risk that they're exposed to, the isolation, we're seeing people being isolated as a form of protection while they're incarcerated, which is, again, kind of this really warped way of presenting that kind of information. So it's kind of this weird, people are, I feel like, maybe not in general, but looking at it in this kind of disconnected way. But there's no way for us to get a handle on the pandemic in the city if we are not really addressing the kind of genocide that's happening to incarcerated folks at this moment, especially in New York City.
Yeah, one of our participants is just wanting to remind everyone that there is a Walking While Trans Bill Advocacy Day that's going to take place on May 7th, and you can go to Equality New York's .org's website to find more information about how to participate in that very important advocacy day. And I know that the new Pride agenda is fully intending to support that effort and participate. Dr. Oni, I wanted to come back to you, just sort of managing all of the questions. You talked earlier about the importance and the value of telehealth and filling a void in terms of people not being able to go out to primary care centers. And one of our participants is asking, do you have any insight why New York State is paying lower rates to community health centers for telehealth services than in-person visits? Anything doesn't seem to make sense that we would pay our health centers less money for the important primary care telehealth services than what they do in person. Do you have any sense about this?
No, I mean, I do know that research that has been done suggests that sort of patient reported outcomes are the same for televisits versus in person in terms of like level of satisfaction. I know a little less more about sort of long-term like clinical outcomes, and don't know specifically why there's a differential with the state reimbursing differently. Although, I think as telehealth becomes more the norm, that will hopefully change.
So in this period of social distancing, as you all think about the communities that you're serving within our larger LGBTQ community, how are you assessing community needs, emerging needs, given the fact that people aren't coming in or not able to gather as we would normally? How do we stay on top of the pulse of what's going on in the communities and what they need from us?
I know we're reaching out to those 3,000 participants once a week through staff. So what's being reported back to us, there's certainly the number one priority has been, and I would say it still is, of course, food insecurity. The second most talked about or concerning issue is just emotional stability, right? I mean, they've lost the anxiety that's created by this is created because of the loss of stability, loss of things being usual, things that can routine, everything being kind of tossed upside down. And then the third, we're hearing about, the social isolation issues, which we're trying to address, certainly. And as this goes on and may go on for a while, as it concerns seniors, kind of keeping them out of congregate settings, what we've really noticed is that because of inequalities, there are a lot of folks who don't have the ability to get on the web for a virtual group, for a virtual Tai Chi group, for a yoga group, for any of the things that we're doing right now. Happening at this time, we're doing a virtual Seder. So there are a lot of folks who can't participate in that, who don't have those items that you would need, Wi-Fi and some sort of device. There's also with LGBT elders the issue of, it's technology for some, depending on kind of your age range as an elder, is still not something you're so adept at and willing to accept in your daily life. I think we're going to have to work on that more, and we're thinking we've got some ideas about some pads that we can start getting out to people. And certainly looking at trying to help with that issue, because that kind of seems solvable. So we're staying in this constant contact with them, and the staff report back what the issues are, and it's been really interesting because I think in the end here, we always had a plan, and we're required to have a plan for like shelter in place, but that had to do with like a shooter or a plane flying into a building post 9/11. We had those plans. There was never something being talked about that was of this nature. And as agencies, we're going to have those plans. And now we've gone through it. And we were building the plane while we're flying it. And we've learned a lot of lessons. And I think when we go back, we're going to have to make sure that this is something that we're always aware of as a possibility. Just because of the nature of the world we live in. And, to the end of like electronics and virtual stuff, it may also be the way in which we start meeting a lot of our seniors and continuing with this virtual work that we're doing. Nothing can take the place of face-to-face contact with each other and touching each other. But it is something that can help with social isolation, certainly. And it may just be the new reality in certain ways.
I think also echoing a lot of that, what's been helpful for us in getting an idea of what's going on is really checking in. So we're having office hours every Wednesday for people to drop in and ask questions, but also share stories. There's lots of kind of larger national calls of like, for people to come into space and talk about what the emerging needs are. So I feel like plugging into those is really important. And it's also important to pay attention to what's emerging in kind of a broader sense. So what are the questions that people are asking? What are the questions that people are not asking? And, who is present and who is loud and who is also not present and not being vocal? Like what are, Dr. Oni talked about the kind of the overlay maps about different kind of things like asthma and other health conditions, which really mirror the map of where the spread of COVID-19 is in the city. So that is a lot of information. We have a lot of things and research that reflect those communities and resources that they've needed for a long time. And so we can look at that now and kind of, make some conjecture about what support might be good in those areas. So I think that's really important, but also paying attention in terms of like social media, how this is accessible for some in ways that have never been accessible before, and how this is really inaccessible for others. Like what are the voices we're seeing? What are the voices we're not seeing? And so once we are kind of moving into the next phase of whatever comes next, how do we take all of the good things that have come from being able to adapt everything virtually and get telemedicine off the ground so quickly when there's been so much pushback, especially thinking about people who use drugs. There's been so much pushback against longer take homes for methadone, providing bupe inductions via telemedicine. And now it is here, and here we are. So it could have been here this entire time. So taking some of that information that we're getting, obviously it's really hard to be responding to this in the field, and also like collecting data in the moment and imagining what data might be helpful in 3 months. So really just getting a good idea in a broad sense is also sometimes helpful.
At the Bureau of HIV, especially with our Ryan White Part A funded programs, we had already started started changing our services and providing services to address the issue of social isolation. So even with our supportive counseling providers, mental health providers, I think harm reduction providers, we had started last year to provide remote counseling just by phone. And in the work, before I came to the health department, I was at Montefiore, which is being impacted very heavily by the COVID pandemic. And I did a lot of HIV-related research. And I remember for many of my patients living with HIV, when I would enroll them in studies and my research assistant would call, many of them would, and that wasn't part of the intervention, to call to remind them to come to a study visit. They would say, well, that's the only call I receive all week, and I really look forward to it. So even something as like low tech as a phone call, and I think as Steve was saying, just like calling people, it doesn't have to be like a virtual town hall. So, as we, pivot to telehealth, I think a lot of our funded programs are really taking this approach to check in on the people that they serve and the communities they serve. And even just, because we're all being impacted by this, we're also using the same model at work for our 300 staff. I'm making sure that all of my staff, all supervisors speak at least once, like hear the voice, hear how someone's doing, because you can't always read everything through an email. Just having that human connection is so important at all levels.
So one of the things that, and you heard this in the beginning when Cynthia was speaking about New Pride Agenda, really paying attention to the state budget and to legislation in Albany. And as you think about, I know that I just saw a rush of bills being introduced over the last couple of days in Albany that are COVID-19 related. But from your perspective and your touch in the community, what are some of the things that really should be paid attention to? Is rent and income and healthcare access, are those the things that we should be paying attention to? Or are there other things that you would want to put on the radar screen in the community?
Yes to everything that you just mentioned. I mean, yeah, obviously, yes, no, totally. Like housing, healthcare, education. I mean, these are all areas that have been there's been disinvestment. And you reap what you sow, and we have outbreaks happening in areas of congregate settings, prisons, jails that could be avoided if we really change the way we think about we can't go about business as usual, and this is a time to like really reset and establish a new normal, one where we recognize the humanity of everyone, and we recognize an opportunity to really begin to dismantle many of these systems of power and privilege and oppression that lead to these inequities. And it's a time to really reflect. Yeah.
I guess something I've been hearing from participants, and it's why the one that resonated was about the rent and the landlords and all of that, and why don't they have some skin in this game too? If people are losing their jobs, their second job, and not able to pay rent, I understand that people won't get evicted, but that doesn't mean that their rent isn't going to be due at some point. And it's really stressful for folks to have this hanging over their head right at this time. So I'm just kind of surprised that has not been pulled together, unless I missed it.
No, it's not been done yet.
Yeah.
I think the other question I would just toss in is, should we be looking at ways to think more creatively about revenue to make some of these investments? Yes. Where should we look? Where should the state be looking? There's a lot of conversation about millionaire pied-à-terre taxes in New York as ways to fund some of these social investments. What do you think about, where are you with that conversation?
I mean, definitely taxing billionaires is a huge point, but I feel like there's always this kind of feeling of like we have to find the funds as if they're not there. But the funds are there. They pulled together a huge bailout for Wall Street. That money did not just, appear, and they've found money to send stimulus checks. They've, had money for their very large jail plan in New York City, which was, $11 billion worth. So I feel like I don't want to get stuck in this, like, where are we going to find the money? Thinking about housing, like, how are we going to fund housing when there's vacant houses and vacant hotels and, all of these, like, Airbnbs that people aren't staying. Like, I feel like the resources it's not that the resources are not there, they're just not allocated in a way that's accessible for people.
It's part of the work, really, that New Pride Agenda will be doing in Albany on an ongoing basis, really to track where the money is going and essentially to fight for our fair share of the state tax revenue being invested to support our communities. And I think, Dr. Oni, I've heard you say this many times, that one zip code is more a determinant of health outcomes and opportunities in life, and we need to start paying attention to that. So let me invite you to each of you to offer a final word of wisdom, a comment, something that you'd like to leave with all of us this evening. Nathalia, would you like to go first?
I think my final words would be something along the lines of really kind of for us to take the time to understand that some of the fear that we're having around COVID is part of the experience of people who use drugs on a daily basis, about like, am I going to get the care that I need? Are people going to see me? How am I going to deal with this isolation? How am I going to deal with this exclusion from society, or my death not being counted or not being factored in? That's part of kind of the stigma of the experience of people who use drugs. And on top of that, people who are, part of the LGBTQ community who use drugs, having that increased isolation even from their own community. So just to keep that in mind and to remember that again, this is not, it's not kind of like there are these people over there that have this lived experience, that they're, our family members, our elders, our children who are kind of having this experience. So having compassion and sympathy and really trying to be non-judgmental while supporting their community and remembering that everybody needs support in this time.
Thank you, Nathalia.
Unfortunately, I kind of already spoke about my one closing remark, which was about how incredibly resilient the community is, and how they're working through this, and we're learning, and it's made me appreciate certainly that it's easy in a day-to-day life to forget how precious life is and how in the moment you need to be and to remain. And I think a lot of our elders understand that because, they get a sense that there's a shortening of their life, and they're gonna experience it more fully, and that's why they're so in need of community and being together, and it's hard to wait, and so I'm there for them. I'm there for that trip and to try and make that work. I think as SAGE, we've learned, that there's certain safety nets that we can put in place, and ways in which we can ensure that we're able to handle this better should it occur again, and or need to be something that happens, and that we need to be prepared for that. But our community are for the most part, as long as they can stay well, I think they'll survive this and they'll be okay. And I really respect them for that.
Yeah, your question had me thinking about, there's someone who I follow on Twitter and Instagram who is a Buddhist Lama or teacher, and he had posted, if one person has COVID, we all have COVID. And that was sort of modeled after, the HIV epidemic, when a number of theologians talked about, if one of us has HIV, we all have HIV, as a way to cultivate and extend compassion and empathy. And so I think about that, and I think about this as we have that opportunity to do that now. Nathalia had mentioned this community care, so the way that we are taking care of one another, the way that people living with HIV, their providers are all working synergistically to support one another is really important. And I hope that that is something that I think it's always really been the case. I think with people and their providers, with HIV in particular, people are very close to their providers and trusted providers very much, and the community has always been very strong. And so I think that will help to buoy the community during this time and as we move forward.
Thanks everyone for joining us for the first New Pride Agenda virtual town hall meeting. You've been having a conversation with Dr. Oni Blackstock from the Bureau of HIV/AIDS Prevention and Control at New York City Department of Health and Mental Hygiene, Nathalia Gibbs from the Harm Reduction Coalition. Thank you for being here this evening. And Steve Wilkinson from SAGE. Thank you for being a part of the conversation. I want to turn it over to Ahmed, who is going to share, Ahmed and Jason, who are going to share a little bit more information about the next couple of virtual town hall meetings that are coming up, sponsored by New Pride Agenda.
Yes. Thank you, Doug, and panelists. This has been such a substantive conversation, discussion, so much insight in the last hour, and so I appreciate you guys sharing all that knowledge. Like I mentioned at the top, we are doing this on a regular basis, this virtual town hall series, while we remain in quarantine. The next one will be this Thursday, April 16th, and that's focused on youth, and particularly LGBTQ youth, and what it's like to not be with your friends and community out in school, away from your home, or away from your family, and what it's like to be isolated. That's the through line of these series, I think. The following Thursday, on April 23rd, we'll be doing another town hall on the topic of sex, emphasis on sex workers. And so we've developed another star-studded panel. I think it competes a bit. It does its job competing with this one. And so we'll send you guys reminder emails along the way about these town hall series. We just wanted to give you guys another reminder before I hand it off to Jason. We'll be working on developing more town halls on more topic areas. So already in the queue, we have another one on the topic of immigration and the intersection of what it means to be undocumented and needing to interact with healthcare facilities and institutions. Another one on just the mammoth of financial insecurity and how an entire swath of our community are service industry professionals. And so now that they don't have access to that income, what can we do to support in conversations around that? And then the census is out and it's important to fill it out. And so we're going to make sure that our community gets counted even in this time. And so we're going to have another town hall on the census, and just stay tuned for events and reminders about those. Jason?
Yeah, thanks, Ahmed. Just really want to come just so love, appreciation, and gratitude to not only our amazing panelists and hosts, but also to you all who joined this very important conversation today. As Ahmed said, we're going to be doing this is a part of a series, and we also want to hear from you all. So if you have ideas or suggestions around topics that you want to hear or things that you think we should uplift during this time, please send them over to us. We would love to create space for these type of conversations. You can email me at jason@newprideagenda.org or ahmed@newprideagenda.org. We'll also put them in the comment box. So we really want to make sure we have as many spaces as these as possible, just so we could show support and community to each other during this very important, serious, and critical time.